Assessing placentitis in mares. Thank you very much for the introduction, and we'll move along. What is a placentitis mare? I think that we need to try and define them first off. The technical definition would be a mare that has an infection of her placenta, which we see quite frequently. But we generally speak of these, we talk about placentitis mares as mares more generally than those that just have an infection or inflammation of their placenta at the moment. We often talk about mares that have aborted in the past or have delivered sick or weak foals with poor placentas. The other mare that really fits as a placentitis mare is a mare that has bagged up or has got discharge. I think if we want to really understand placentitis mares, we need to look at what causes pregnancy loss. We need to remember that this is looking, this chart, this pie graph just shows us the basic major categories of pregnancy loss in the Hunter Valley over the last 15 years. So placentitis, actually more than half of the causes of the pregnancy loss are not caused by placentitis. The other big cause is cord perfusion, cord twists. And the big difference between the cord twists and placentitis is that placentitis does tend to occur later in gestation. So I think if we're going to try and prevent placentitis, we need to try and pick out our placentitis mares. Now, and that can be a really big challenge, making good selections. The mare that's bagged up or has discharge, I mean, that's pretty clear. They have a problem. But the difficulty about that is that means we're fairly late in the disease, and frequently the foal's growth rate has been compromised, and it is quite much more difficult to treat them by the time they get to this stage. You can pick them based on their history, looking carefully at the reasons they've lost their pregnancies, but any mare that has lost a pregnancy more than once is much more likely to lose the pregnancy she's currently carrying than a mare that's only ever slipped once or never slipped at all. So that does alert you to the likelihood this mare needs to be watched and needs to be cared for. The other one I often get asked to look at is the mare that has been hard to get in foal. I don't think that necessarily means she's going to be a placentitis mare, but it does kind of make the pregnancy very, very precious because of all the hard work that's already been done. So we tend to monitor those mares a lot more closely. So really, if you're going to sort of start picking out your placentitis mares on your farm, it's really important to determine the cause of abortions that occur. Remembering again that more than half the abortions that occur are not due to placentitis. As you can see over here, these ones on the right-hand side of the pie graph, they're all placentitis cases. And then we've got all these other causes as well. So with these other causes that aren't infections, antibiotics are not going to make one bit of difference in whether that mare loses the pregnancy or not. I think there's certainly a number of different causes of placentitis, and there are some of them that it's probably most important that you should try and prevent, and particularly EAFL. You're much better off trying to prevent EAFL and also chlamydia than having to try and treat them. So looking at the different causes of placentitis, so this is drilling down into the causes that we've had in the last 5 years. So we've got the most common would be EAFL and EAFL suspect cases. And then we do see a lot of placentitis, the psittacosis cases, the chlamydia psittacosis. This is probably a little bit skewed because we had that big outbreak in 2016, which is in this data set. So I don't think it's going to end up being that once we've done 20 years, it won't be quite so high. Then the next most common one is the ones with placentitis that we don't actually figure out what caused it. Ascending placentitis makes up about 15% of the causes of placentitis, remembering that placentitis is only 40% of the causes of pregnancy loss. And then the last form is this, what we are now calling chronic active placentitis. It's got lots of other names. It's called, often called focal mucoid placentitis. And the Americans refer to it as nocardia-form placentitis, which is an absolutely dreadful name because it's not caused by nocardia necessarily. So thinking of the causes, if you're trying to prevent placentitis, the way you're going to prevent it is going to vary very much with each cause. So let's go through the causes a little bit. EAFL, controlling processionary caterpillars. Now, most of you have heard lots and lots about this, especially those of you in the Hunter Valley, probably sick of us going on about it. But and being aware of looking for the egg masses in November, December, and then looking for any nests that are developing and removing them. The best time is to remove the egg masses if you can get to them, because that is the safest for the humans and it prevents any of the caterpillars starting to develop. But then just being aware, everybody looking out for the nest material and getting rid of it and getting it off your farm is going to be one of the most useful ways of reducing losses due to placentitis. We need to learn a little bit more, or quite a lot more, about Chlamydia psittaci, particularly about how the birds are likely to be contributing to it. And controlling birds, I think, and the interaction between wild birds and horses is going to be would be quite difficult. And so I think that's something we need to do a lot more research on in the future, I hope. The unknown causes, I think as we learn more and do more systematic reviews and of the cases that we see, hopefully there'll be fewer unknown cases and we'll have diagnoses. And yes, so we'll be able to put them into categories. And then if you know the causes, you have a much better chance of figuring out a prevention program. Then the last two, ascending placentitis and the chronic active or focal mucoid, those both causes of placentitis that I think are most effectively prevented by monitoring the individual mare and treating when you detect a problem. So if you're going to monitor the pregnancy, what are your options? Ultrasound is the big one. It's widely used. And we've been using it probably for 20, 30 years now. And it's now that ultrasounds are really good, ultrasounds are a lot more portable and a lot more, and not as expensive as they used to be. It's much more, it's a much more effective method. The only problem we have with I have with ultrasound, and I use it a lot, obviously, is we don't have any data on the specificity and the sensitivity of it in detecting placentitis. The sensitivity is how good is it at picking up every case of placentitis that exists. And we know that there are cases of placentitis that get missed even when you ultrasound the mare on a really regular basis. There are also, with specificity, when you see abnormalities on the ultrasound, they don't always mean that the mare has a placentitis problem. And so it's a little hard. We don't know exactly what the specificity and sensitivity is. And so I think it's always got to be interpreted with care and caution. And it creates its own problems. So just ultrasounding. The other things that are becoming quite useful, or that we've been looking for a long time, are what we call biomarkers. And that's just things that are in the blood mostly that will help you determine whether the pregnancy is going to be lost or whether there's a problem in the pregnancy. And once again, we've been doing this for a very long time, and we'll talk a little bit more about progesterones and estradiol as they seem to be quite topical at the moment. Alpha fetoprotein may well be a very useful protein to detect. There's a bit more research, I think, that needs to go on, and a bit more development before we could use it clinically. but it's probably likely to be as useful as progestins and estradiol. Where am I? Go back. There we go. The serum amyloid A is very disappointing. It looked like it could be wonderful experimentally. It's really quite specific and sensitive, really quite sensitive. It's not very specific. But in the field, it's really not been as useful in picking up pregnancies. Picking up problem pregnancies. I've actually had mares with completely normal serum amyloid A go on to abort 2 or 3 days later from things that were, placentitises that would have been around when we took the blood sample. Relaxin is a protein that was looked at many years ago. It is effective at detecting mares that have problems with their pregnancy, but we don't seem to have any commercial assays available to use it, and it seems to have sort of gone out of fashion a little bit. So looking at monitoring with ultrasound, it's probably useful to think about what the different forms of ultrasound are actually useful for. So most of us will do transrectal examinations to determine, using the ultrasound. And this is probably the most widely used method to assess problem pregnancies as a screening tool. And I think most people these days, when they're doing the preg test, use an ultrasound and get a quick idea of how the pregnancy is looking and detect mares that may need further follow-up later and more monitoring, and that's quite good. The rectal exam is actually very good at detecting ascending placentitis and the later forms of EAFL, but once again, you've got to think about placentitis is the only causes less than half, 44% of our losses, and these other cases like poor perfusions and a lot of these other ones will not be picked up by the rectal ultrasound. And then a whole lot of other causes of placentitis, the early EAFLs, the chronic actives, they can't be picked up by that as well. So rounding it out with an abdominal examination in your high-risk mares or the incredibly valuable mares, I think it needs to be considered. So with the abdominal examination, you can pick up a lot of cases of chronic active placentitis, but unfortunately, certainly here in Australia, we see cases that are way up the horns, the pregnant and the non-pregnant horn, which we just can't reach with the ultrasound of the very pregnant mare. The abdominal ultrasound is much more useful in picking up the early cases of EAFL, and it may well be useful in picking up chlamydia cases, although we haven't had an opportunity to really assess that. But it also will pick up cord twists, particularly if you're examining them in fairly early stages of pregnancy. Biomarkers that are interesting, I think the ones I'd like to talk about are the progestins and estradiols. And this is a study that was done in Japan quite a few years ago, which is it's an outstanding study. They looked at over 500 thoroughbred mares that were for one pregnancy, monitored them, took blood samples on these mares monthly throughout their entire pregnancy and recorded the outcome of the pregnancy. Now, the solid lines are the mares that had healthy foals, and the dotted lines are the mares that had the sick foals. And you can see that the progestins, they're normally low from about 28 weeks to about 40 weeks, and then they start to rise quite normally. In the mares that lost their pregnancies, the progestins rose earlier, much earlier, and similarly with the estradiol, it's high in that period, and it tends to decrease when you've got placentitis or you've got other problems. And so it was quite predictive. And it's they have presented that the combination of the level of the two hormones is more effective than looking at one in isolation. And I think there's some more work coming out of Kentucky which is not as clear cut as this. And so I think this is worth using, and I'm starting to use the progestins and estradiols as together in my clinical work quite a lot more, and finding it quite useful. So if you want to develop a placentitis prevention plan, in summary, I think what we want to do is get rid of these and get lots of these. So in order to do that, I really think it's very important to understand what's causing losses in your farm, on your farm, in your area, that are specific, and then also what's causing a loss for that particular mare. So you can then plan what you're likely to want to do. So that will allow you to better select your placentitis mares and better determine what sort of treatment plans you're likely to use. Keep emphasizing controlling the environment, particularly with the caterpillars. As you saw in our graph, there's still a high prevalence of EAFL, and we are aware of it. I think we need to look more closely at trying to get better at controlling the caterpillars. And then hopefully down the road, once we've done some more research on birds and the psittacosis, we'll be able to give you some plans for how to control that form of placentitis. Last but not least, monitoring and treating, using both ultrasound and biomarkers to monitor your high-risk mares, and also to time a screening probably of all your mares to identify any of your problems.